My name's Damian Roland. I'm a Paediatric Emergency Medicine consultant who works at the Leicester Royal Infirmary, and as well as being an active clinician, I'm also an academic, but I also help as part of the digital program of both the new build in our hospital, but also the IT infrastructure around that new build. So anyone who works in the NHS is aware of some of the constraints that we've had with information technology and becoming more digitally enabled. What is quite clear within Leicester is that there is a vision for where we want to get to, and we are definitely on that journey. The great things that we're doing here are the fact that we have realised that if you take a clinician and a manager and IT and you bring them together and you give them the time and the space, and I think time is really important here, to develop new ideas and review what is being proposed, you end up with a much better end product. And I think one of the great examples of that is the deployment of our emergency department information system within our new emergency department, which came as a bit of a surprise to us because we were going to go for a full EHR solution, and we were denied that opportunity. So we had to think really nimbly on our feet in a short space of time, and took a small group of people, both clinicians, managers, and IT developers, and came up with a fit-for-purpose solution for our emergency department within essentially 6 months. It was an amazing piece of work, and it's demonstrated how that collaboration can be really powerful. And it's nice to see those initiatives working in as part of the whole kind of EHR program that this trust is undergoing. And an example of the benefits of doing that is we are one of the busiest emergency departments in the country, and we deployed a completely new information technology solution within our emergency department in a 24-hour period, and we really didn't change the performance of the patient outcomes at all in that period. And as far as I'm aware, that's the first time any large institution has ever pulled something like that off. And the other core things that have come out of this, I think it's given people, one, the clinicians, the belief that if you get engaged, you'll get the outcomes that you like, but also that from I think a trust and board perspective, they understand this importance of bringing people together. It isn't easy. We don't get it right all the time, and I think we've still got a lot to learn. But getting that triumvirate together and right, I think, has been the biggest change within this trust, and it's certainly going to pay dividends over the next couple of years. So one of the things that I found kind of really exciting in the role that I do, as well as being a clinician, I'm an academic, and I'm a bit of a data geek. And being engaged with the operating systems of this institution has enabled me to draw back some data which I can use, which ultimately will improve patient outcomes. So I'm convinced of that. It's going to take time, but we'll be able to do that. And I think traditionally we've had an issue with engaging clinicians in these projects because they're not sure what's in it for them, or when they do get involved, they don't get the return on what they want. And myself, and certainly Ben Teasdale, my adult collaborator who works on the adult side of the emergency department, are both aiming to try and get other clinicians involved and show them how we can use data so that you can help yourselves. And it's not just a one-way street, it's a 2-3-way collaboration. And we're about to do a really exciting piece of work with one of our data providers using artificial intelligence. So taking this vast amount of data that we're collecting and analysing it, and then being able to feed that back to clinicians so that those clinicians can make more sensible decisions or look at their service plans and then deliver better outcomes for patients. So one of the things I'm personally really excited about, so I'm interested in scoring systems and the way that we look at children who present to our emergency department and how we recognise who are the most sick children or who are the most well and we can discharge earlier. And one of the things that we've got some early evidence from some of the data analysis is this prediction of how long you're going to stay in hospital based on your first couple of hours in the emergency department. And there's a really exciting project that we're about to undertake where we may be able to predict occupancy in the hospital the next day, dependent on who's presented today. And the real advantage of that is that from a management and clinician perspective, If you know at midnight how full your hospital's going to be the next day, it means you can plan for staffing, you can plan for your elective workload, you can make decisions based on real-time data that you weren't able to do before, and that might help you rationalise or make much more sensible decisions, both from a local department perspective but also from a trust-wide perspective. If we can get that into a real-time system so that we're operating that permanently, and on any given day you know what's going to happen tomorrow, you can imagine the benefits that that has for everyone involved. Personally, one of the things I'm most excited about is after a decade of digital innovation not really moving anywhere, I do think we're finally at a cusp of being able to transform what we do. And personally, I go into work now always excited about dealing with patients because that's my primary job as a doctor, but it's not quite the heart sink we used to have when we deal with IT issues. And I think if more people start to get that impression, it's going to be better for everyone.
I'm Ramandeep Kaur, and I'm the Operational and Clinical Project Manager at Leicester Hospitals for the rollout of eMeds, which is part of the eHospital programme. I'm also the Advanced Specialist Pharmacist for eMeds and work as part of the eMeds team, which are a big team at the moment that are rolling out electronic prescribing and medicines administration across University Hospitals of Leicester. So currently at the hospital we have a really exciting eHospital programme that has a number of projects involved, one of which is eMeds that I'm very proud to be one of the leads for. And this project involves us rolling out electronic prescribing and medicines administration systems to the entire trust. At the moment we are currently rolling out to the Glenfield Hospital, and we have just completed a rollout to vascular, cardiac and thoracic surgery last week, and we are due to complete next week and the week after to cardiology and respiratory. This has been a really exciting time for us, as there are many benefits of introducing electronic prescribing to a trust of our size, including reducing the time looking for paper drug charts and increases legibility of charts. It saves time both clinically and for our nursing staff. It also reduces prescribing and administration errors. And I'm, as an individual, very passionate about patient safety and digital innovation, and this project has certainly allowed me to demonstrate that, but also be part of something transformational for our hospital and work as part of a multidisciplinary team, including our clinicians, our nursing staff, our pharmacy staff, our dietitians and many other allied healthcare professionals, in order to come together to produce something and exciting for our hospital and roll out something that was already implemented at our Leicester Royal Infirmary site last year and prior to that, and be able to move forward in improving our patient care, which is very important for us as a trust. So for us, moving forward, our vision is to continue the rollout of electronic prescribing as per the Lord Carter report that was written many years ago now, and also recognise to become one of the digital exemplar sites for electronic prescribing across the country.
I'm Linda White, I'm a Senior Project Manager, and I'm currently embedded within the eMeds team and have a dual role. So I sit within the eMeds team for the delivery of the project, working with my colleague Ramandeep Kaur, but also I actually sit within the I&T department. So the project that I'm currently working on is the delivery of eMeds across University Hospitals Leicester. Within that, I have a responsibility to ensure that that the project runs to time and within budget, but also it's about the innovation side and working with a clinician-led project. The other side to the project that I'm heavily involved in is around what I consider to be sort of the main pillars, obviously, of good project management within a very diverse organisation. And one of the key things is about engagement and having the right clinical engagement to enable a business change, in effect is what it is, a transformational change across the trust. And that's very key to being able to successfully roll out any change within an I&T forum, if you like, albeit clinically led. The other thing, obviously, is around ensuring that you have the right resources around you, and certainly having the right team and having the skills to be able to support the e-hospital programme, particularly around the eMeds that I'm involved in at the moment. I've worked in the NHS for a long time. I've worked in the NHS on multiple projects, whether they'll be small or huge hospital transformations. And what particularly drives me and brings me to work is the excitement about making a difference. So even though I'm not clinical, I work with my clinical colleagues to the same end, and that is to ensure that patient safety is at the heart of everything that we do, and also to make the lives of clinicians particularly hopefully a little bit easier with the use of technology.
I'm Julie Ball, Assistant Chief Nurse at University Hospitals of Leicester, and I also fulfil the Chief Nurse Information Officer role. The main drawing factor to my role was actually looking at technology to support improving patient care, both in the way of administrative tasks that it could do for clinical staff to release them time to care for the patient, but also then how can we support getting the information about the patient to the right patient in a more timely way. And that's what was my driving and my everyday reason I get up to come to work. I've been doing this role now for 5 years, and the most challenging part has been to get the clinical staff to engage with our IT staff so that we have true staff engagement in the digital technologies development with our IT team. And whilst we're still on a journey, we've got to a place that I'm very, very proud of and excited about for the future. The most significant digital achievement in the last 12 months from a nursing perspective has got to have been the rollout of the nursing assessments electronically. We'd already captured all of our vital signs electronically, and we can do automatic alerts. Now that we've got the risk assessments, we can see all the risk factors of a patient on a mobile phone, and it's in the palm of the clinician's hands, so we're getting more timely referrals, etc. And the right management plan put in place at a much earlier opportunity. For the NHS, the biggest barriers are going to be about resources, and whether that be money, whether that be the right skill set and the staffing, but that's the biggest barrier. The most significant development in the next 12 months for health and care is, in my view, and for the patient's point of view, is the transfer of information between health and social care and vice versa, to ensure that we're all working from the same document, we can view, we can share the right data, and I think that will have a huge impact on what the patient receives. If I had an unlimited budget to spend on digital transformation, it would certainly be to use the model we did with RED, where we had a new build. We built that knowing we would be going in there to be a paperless environment. And if I had an unlimited budget in the future, I would follow that model because that was a complete and utter success for us. Going forward, what excites me and continues to surprise how much it excites me are the opportunities that digital technology will bring us in improving the working atmosphere the working environment for staff, but also the safety that it brings for patients and the communication with patients as we move forward using patient portals, etc. One of the important elements I feel as a Chief Nurse Information Officer has been to ensure that you've got clinical staff, IT staff from the hospital and the provider in a room working together, talking the same language, and ensuring that we are clear about what we all need to achieve. I do think that's absolutely critical to get a system that works for clinical teams.